My name is Howard A. Kornbluth, and I'm a student at St. Petersburg College. I now present Informatics Final Project. My subject is an application entitled Dr. Mole. This presentation tells the tale of the wonderful world of Dr. Mole. What is Dr. Mole, you ask? Dr. Mole is an application that you can place on your cell phone, your smartphone, your iPad. Dr. Mole can tell you if that weird growth or mole has the possibility of being cancerous. The purpose of the application is to assist the non-professional in the clarifications of any suspicious skin growth. Let's be honest, we live in Florida and skin cancer is prevalent. Dr. Mole can be a vital educational tool regarding what to look for when one is practicing self-examination regarding skin cancer. Dr. Mole is easy to install from Google Apps and very, very affordable. There are two price levels of application. For free, you get a very basic explanation, and for just $3.99, you get a more advanced version that goes into more details of the results. The education of our patients is a vital part of our job as nurses. Nurses can instruct their patients about the importance of self-examination and how easy it is to use this application. If the patients can take a picture with their cell phone, smartphone, or iPad, they can, with the help of Dr. Mole, figure out if that weird bump on their skin is something to be concerned about. Dr. Mole is a fun application. Dr. Mole is very user-friendly and guides even the most inexperienced layman on the application's proper use. Once you download the application, you simply open up the application and take a picture of that weird growth you may have. Within seconds, Dr. Mole will review with you the base of skin cancer identification regarding the mole in question. The way your mole is identified is via the famous ABCD acronym. Is the mole asymmetrical? What does the border look like? What is the color of the mole? The diameter? Usually, a melanoma is larger than a regular mole. The last letter E stands for evolving, or how fast is the mole changing? Each of the letter of the categories will be given a percentage from 0 to 100. The higher the number, the more likely the molar growth is suspicious and needs a second look. The results are easy to understand, and each letter and percentages are clearly marked. One does not need to be a doctor or nurse to understand this application. While this application is innovative and easy to use, it does come with a caveat. Clearly stated, this application is for educational purposes and is not a substitute for a trip to your local dermatologist. The application is not a substitute for medical advice. However, like any good instruction self-examination, it gets you talking to your doctor. The more people talk to their doctors, the quicker skin cancer can be detected, and early detection is what this application is all about. If you find high percentages with your mole analysis, get thee to a doctor as soon as possible. I happen to love user-friendly applications. The benefits are simple. This device may assist in the early detection of skin cancer. The earlier the detection, the possibility of a cure and less scarring surgery. The limitations are few, but important to state. First, you need to be able to take a clear picture of the mole in question. So, what happens when your mysterious mole is on your back and you have no one to take a picture? The other limitation is your skills as a photographer. Can you hold the camera steady? Dr. Mole is very easy and fun to use. Dr. Mole is very affordable. I splurged and purchased the $3.99 version, and I found it more informative than the free version. Nurses should highly recommend this product for the patient who has had skin cancer or a high risk for getting skin cancer. It is an excellent educational tool. It is advisable that with any self-help tool, the user will benefit from the app if it gets him or her to the doctor regarding any suspicious mole. I have had skin cancer, and ever since I found out about this product a few weeks ago, I have been using this application. So far, so good. My references.